So yeah, my other panel was about technology and how nurses are kind of adapting it. And this one is completely technology, completely talking about AI and how it is making inroads in healthcare and how fast it is changing and how it has come to a founder's dilemma where every day something new is happening and you just hear it in the news that someone has broken through some AI technology in the rest of the world, and then you are gathering your horses around it. So in healthcare specifically, the other day, a few days before, we had uh, even Google has unveiled a breakthrough which is through the eye and retina, they can detect the heart disease now. It's a big breakthrough which has happened recently. So this is how fast things are changing in healthcare and healthcare tech specifically. So let me start with Dr. Dastidar. Sir, tell us how fast it is happening, how are you gathering around it, and how are you kind of, when you see this big breakthrough happening, how you foresee it also?
Okay. So thanks for giving me the opportunity to be here today. Thanks to the entire BW team. So in terms of technology penetration into healthcare, it is happening at breakneck speed. And we had the nursing panel just talk about this before. And this is something I personally did not know about, that there is so much of technology in nursing as well. This was quite a bit of learning. But there is a lot of technology penetration in other technology and AI penetration in other areas, as you rightly mentioned, about, like, say, for example, Google detecting heart diseases from the retinal scan. But that said, what we also need to be a little bit of cautious about is we need to be cognizant about the need for clinical validations before adopting such technologies. Technologies come up every day. Some technologies end up working. Some technologies, in spite of being coming up with big bang releases, take Theranos for example, end up in the dustbin where they rightly belong. And some technologies work, but they just do not solve the right problem. So first of all, we need to figure out whether the technology works or not. And for the healthcare world, there is only one way to find it out, is through thorough clinical studies. And that is one area where I see there's a bit of a lacuna. I mean, Google can make that claim that, okay, we are predicting healthcare, we are predicting the risk of heart diseases, but on how many patients and through what demographics and age groups have we actually tested that algorithm?
Mr. Pruthi, what are the possibilities that AI is bringing in healthcare? We know that diagnostics is taking the lead in that. We are detecting a disease faster. It is helping in diseases like TB. And going forward, what possibilities do you foresee?
Sure. Thank you so much for the question around this. I think the possibilities in the last couple of months, or even since we've been working on leveraging machine learning, AI in various use cases, what I foresee with regards to how we'll be leveraging AI specifically is going to be a lot around personalization. That is going to be a central theme around leveraging data and technology, which means that when I work in chronic disease management space, which means that if anybody is a diabetic, the protocol for me in terms of nutrition, supplementation or medication would be fairly different from somebody else, keeping in mind clinical validation of data, right? But leveraging AI will kind of give you the right kind of frameworks, the right kind of data, the right kind of cohorts, which otherwise takes a lot of time, energy to be able to kind of get clinical validation on, right? So one of the things that I significantly see is personalization and contextualization of people, of protocols for people. The second thing that I see is that easing out of workflows in time and energy that the medical fraternity kind of spends in catering to patients, right? Whether it is documenting medical prescriptions, reading blood test reports and making sense out of them, or doing a lot of operational tasks that a doctor or hospital or any pharmaceutical network does, right? Easing out on the workflow automation is something that I see is going to happen significantly, and contextualization in general is what I see as future of healthcare by leveraging AI, right? For instance, if I talk about certain examples in our company, we use a lot of AI to personalize nutrition and supplementation protocols for our clients. We also use AI to even talk to clients as well with very little human intervention, right? Obviously, we vet the data, vet the communication that happens between maybe a doctor or a client or a nutrition or a client, but we even leverage AI to be able to do that so that there is as little human dependency as possible going forward, given the less doctor to patient or nutritionist to patient number that there is in India and across the globe. So that's what I kind of foresee, right? But keeping in mind, as Dr. Tathagato said, keeping in mind legitimacy, correctness, and clinical validation of all the information that we share. So yeah.
Mr. Gupta, there is, generative AIs of the world which have come in, ChatGPT, Bard AI. What are the use cases of those in healthcare? We haven't heard a lot about it. When I was speaking to a few people, they said, it needs clinical validation. We need to know where we can use it. What are your views on it?
So, hi, first of all, thanks to everyone for inviting me at this such a wonderful platform. So, AI we all have been seeing daily in our life, and specifically with relation to healthcare. Now, I also represent a company which is actually working on some technology. As far as somebody will ask me, I would say that maybe the real potential of AI has never been explored in India. I think you go around and check around in the markets like US and all to what level they have implemented AI. And AI, I think it's just majorly being used primarily, to tackle some basic problems. I think the wonders what AI could do is just beyond imagination. And I think what you was just rightly said that, we were just working on some technology, and I was just reading at some reports there, like for example, it could be implemented with the prescription pads, what the doctors are writing, and how much time a doctor is giving to his or her patient. That is one important factor. And there are so many things that could be seriously, implemented through the hospital management system. I mean, I don't want to quote anyone, but we all know how many ghost surgeries are happening. I mean, most of the hospitals have made surgeries a package. And then there are companies also which are coming up and offering those packages, even the pickup and drop facility from the patient to the home and then after the surgery. Do you think so, that this is going to help anyone? No, I don't think so. It's not just a lacuna, it's the complete wrong ecosystem, right? I mean, I think one should be talking about that if a hospital or any medical fraternities recommending or suggesting any kind of a surgery, is that surgery required on first place? Do you imagine what is the number of surgeries happen in the gynecology, in the C-section, cesarean, or normal deliveries? There was a study done by CDC, if I'm not wrong, in US for all the geographies, and the number of ghost surgeries for India was one of the highest. So I think we are just focusing about giving discounts, talking about some generic thing. This is nowhere AI. AI is something different. I mean, we are working on nanobots, right? I mean, it's a drying research pipeline. It's a drying antibiotic pipeline. I think AI is a beautiful concept, where you can even understand that how the morphology, how the genetic coding and the mutations are happening in the microbes. Why, to what level, and what is the reason that is triggering the mutations within the microbes. So I think we are focusing on something very basic. I think one of the best example is telemedicine consulting. Telemedicine consulting was just a setup that was designed for that particular situation. COVID has gone. It's been 2-3 years. But teleconsultation is still going on. Can you imagine a patient who is having a stomach ache? How can a doctor do the diagnosis properly just by looking at the mobile phone? But it is happening. And the diagnosis is done in 40 seconds, maybe less.
It's still debatable, right? We have bed occupancies increasing. We have healthcare institutions which are splurging with, patients. There's always need for more doctors. So, telemedicine comes as a technology which has helped also. I mean, if you talk about the healthcare professionals and their workload. Coming back to the topic and, challenges that Mr. Gupta also highlighted some of them. What are some of the challenges that are coming with AI right now? What are those specifically if we talk about patent tech challenges, what are those, Dr. Dastidar?
So you see, the AI that is being used to develop solutions for the medical world are not necessarily unique. I mean, the same neural network which is being used for image recognition of cats and dogs can very well be used for detection of, say, pneumonia or something in chest X-rays, right? So the patentability of the AI itself is questionable because all these neural network architectures and things are practically open source and they are being used in a wide variety of applications. So the way we look at it at SigTuple is basically we try to patent the use of that AI around specific problems. Okay, given say a sample slide, how do we figure out which area of the slide is going to be useful for me to analyze? That is a very problem specific. That is a very specific problem and will be only used for other solutions which are trying to read something out of a slide. So we have a patent around that. So my recommendation is to target specific use cases and the AI becomes an enabling tool for that patent, but not the patent itself.
We're also seeing a lot of caution coming from the top developers about AI. I want to address to you only, Dr. Dastidar, and its future prospects. How are you seeing that, and especially in healthcare, what cautions would you prescribe with its use and development?
Sure. So the cautions which are coming out of the doyens about the new technologies is twofold. One is that it can lead to a massive loss of jobs. And the second is that this generative AI has the ability to bend what is reality. I'm looking at you just because you're sitting with me, but had I been looking at you at a screen, I would have had no way to tell whether it is you I'm talking to or a deepfake AI. So there are challenges there. In healthcare, we are yet to identify too many use cases of generative AI. But the challenge lies elsewhere. AI is trained with data. And that data, how do we ensure the sanctity of that data? Just to take one example, which Apar was talking about, is that suppose I want to build an AI which, given the symptoms of a patient or the past history, wants to predict the treatment protocol. For that, I go to a hospital, take out the treatment history of thousands of patients and train my AI on it. Now, who is going to guarantee that the treatment that was prescribed to that patient actually benefited the patient or the insurance company or the hospital? We do not know that. So an AI which is trained with that kind of data will predict something which actually benefits the insurance company or the hospital, not necessarily the patient. So that is one huge caution that we need to maintain while building AI for healthcare.
Mr. Pruthi, as we dive deep into the AI world and in healthcare, it also needs a lot of data, to give us insights and give us decisions. In healthcare, recently we've had cyber attacks, ransomware attacks. With all this data accumulating and AI using it, what are the cautions there?
Yeah, I think there are multiple aspects to it. One of them, as doctor kind of pointed out, first of all, is to before security, we need to ensure the sanctity of data, with which the model is being trained on in the first place, right? That is the first and foremost thing, right? The second thing is that the outcome that AI gives, AI is also being trained on top of the data that AI generates itself, right? And that in itself makes things even more complex, which is like one step ahead, that अगर AI ने ही data जो generate किया है, if that was not correct and that was used as a treatment protocol and that data is now being used to train further AI, how do you kind of make sure that is being taken care of, right? So Before the security piece, one of the things that we need to like really make sure is that the sanctity of data is being maintained for AI to be trained well enough for us to get results which we could, conclusively say it actually gets results or are statistically significant that they get results, right? The second thing that we also struggle with, which you are now also pointing out towards, is that the data that we are also giving to AI models is PHI, which is patient health data, right?
Yeah.
In countries like US, I worked in US healthcare before I started this company. There is HIPAA compliance, and the kind of implications that you might have on any sort of data breach are huge, right? Similarly, there's also GDPR compliance, right? So you have to be extra cautious with regards to the data that you're that goes outside of it, right? There is significant encryption that happens. There is significant data security measures that are taken, and the implications of any sort of breach are so huge that companies get shut down. Founders also end up being in huge financial implications, right? And in countries like India right now, I'll probably say that I have had even investors say कि grey market में data मिल जाता है, वहाँ से AI को train कर लो basically, right? That's a very real thing that I have seen people say कि data सस्ते में मिल जाएगा, you might as well use that and kind of train your AI on as well, right? Which means that all our data, whether it's healthcare, is available, right? So one of the things is obviously we use various security measures similar to a HIPAA compliance to kind of at least make sure that security of data is maintained. And second is obviously any sort of breach should have significant implications on at least the company, even if not the founder, but at least the company, right? That is very critical. And third thing that I would say is that OpenAI right now claims that it does not make use of any of the PHI that you give to it. But right now, there's still a gray area around that, right? So, as much as possible, at least in the company, what we're doing is we're doing more of hybrid, where we're building a lot of generative AI models in-house. So at least we can, conclusively say that the data is being used in a productive manner and it is not going to the third party. And I understand it's not possible for everybody to do so. But maybe start with a hybrid thing where the very extreme sensitive data is not going to OpenAI unless and until there is conclusive, it is very conclusive that data is not being used elsewhere or there is not enough breach so far, right? So, these are things that we also kind of make sure we do. We're doing more of hybrid where we use a mix of OpenAI and a lot of generative AI models internally in the company so that we kind of protect the data of our clients at least to kind of pay us. So, yeah.
Absolutely. Mr. Gupta, do we need a safety? Obviously, we need a safety net around it. How badly we need it, and how quickly we need it? Because these, the data, it's every day we are accumulating with so many medical devices, remote patient monitoring, and cyber attacks or ransomware attacks have become a usual thing to see in news, which starting now, which will happen if we don't come up with this safety net and fences around it. How badly do we need those protocols?
So I think what Sahil said right now, that what you are calling data, first of all, I'm sorry, no offense to anyone, but it could be crap and bullshit. Okay, pardon my language, but I'm sharing some fact because when you talk about healthcare, we're talking about saving human lives, right? But things here, I'm talking about the Indian ecosystem. Things are done for attention, not with intentions, right? I mean, I'll just quote a few examples. So I think what the good doctor just said also previously, that, whatever we building, be it the hospital, that's a different ecosystem, the insurance service providers, the patients, there you are actually designing and moduling the things the way you want. I'm sure that you take any corporate example, example of a corporate hospital, I don't want to name. Don't you think so? How many complaints would be raised on a daily basis amongst the patients who are there, who are getting their services or treatments done in ICU or rooms, but none of that data is ever made transparent to anyone. You may find a Google review for an ex-doctor as a 5-star rated 2,000 reviews. That might be doctored and monitored, just fake reviews. That doctor might have built a fortune on just I don't know how many dead bodies. So this is all first thing, as I said, that what you are asked is, the first thing what you are talking about, the data in itself, I don't think so it's the right data currently. I mean, I could still recall one of my personal experience. Blue Ocean, the company I represent, was founded in 2018. And after a few years, our intellectual property was granted, patents were granted in India and overseas. So we were approached by Microsoft that, we like the technology you are working, you are not talking about something, you're talking about something which sounds like a science fiction. And while having a call with their consultant, they said that, this very famous personality, I'm sure everyone might have heard about, Robert Downey Jr., he wants to invest in India. And he has 4 companies, Downey Ventures, Footprint Coalition, Team Downey, and one more. And why don't you approach him? We'll give you the email ID and the reference. And I did. So while a call with Jonathan Shuloff, who was the CEO of Downey Ventures, they started laughing. And they laughed for 2 minutes, and I thought that, I don't know what I've said. And they said that, Apar, you're talking about all these things for a geography where the antibiotics are sold on the like an OTC. And we have heard even the cancer drugs, anything, even the sedatives, everything is given off like an OTC. How can you talk like that? Your basic, there is no ecosystem. It's flat. It's a flat line. Just when somebody dies and that, ECG shows a flat line. And then you guys are talking about. I had to get rid of that call. Trust me. So it's all, I think you have to build from scratch. The healthcare, when we talk about the healthcare ecosystem in this country, we can't even use the word also. There is no ecosystem. There is literally no ecosystem. And then we are talking about AI. So I think the first thing is that as far as the question what you answered, asked to me was the data. I think we have things in the place, but as I just said that if you really want to build the right data, I think we have to focus on that.
Absolutely, the sanctity of data, which has been the buzzword of this panel. Again, with the paucity of time, we'll have to wrap this up. Thank you so much for joining us. Thank you so much, panelists, for being here and talking to us, giving your thoughts on AI in healthcare. Thanks a lot. Thank you, everybody.